and sometimes surgeons really don't have that much experience. What's up everyone, Dr. Sagar Patel here, and what we're talking about in this video today is chin liposuction risks. So as you're delving through the internet looking for content about whether you should or shouldn't do chin lipo, you can check out many of my videos, but this is gonna be the most important one where we're talking about what risks are there in doing this procedure. Your surgeon should always discuss these with you, as in surgery we have a thing, you gotta discuss the risks, the alternatives, and the benefits. In another video here, I talked about Kybella, which was one of the alternatives, but in this video, we're really going to talk about the risks. So with any surgery, there's three main risks. Those are gonna be the risks of bleeding, the risks of scarring, and the risks of infection. Overall, before we delve too deep into these, the first thing I would tell you is that the risks of the surgery are pretty minimal. You don't need to go to sleep, so there's no risk of general anesthesia. And for the most part, you're just taking a little medication to relax yourself, so you're just on some Valium. So let's break these down one by one. So the risk of bleeding is going to be one of the main ones. This is going to be controlled by pre-operative patient selection. I'll tell you guys a story. I had a patient who had high blood pressure. She told me it was under control. We did her numbing. We went to the operating room and she said, I think my blood pressure isn't great in the mornings, and actually a vessel in her eye burst. Now, why is this crazy? Is because we checked her blood pressure and it was in the 200s, which is far too high. For that patient, we canceled surgery. She's working with her primary care doctor. She informed me after the fact that, in fact, she does have blood pressure spikes, but only in the morning, which happened to be we were doing surgery in the morning, and we're going to be doing the surgery at a later date once she's primed up for it. If you have history of bleeding easily, having easy bruising, having anemia or low iron, or having high blood pressure, these are factors that tell me, even though you're healthy and you think you're doing well, we need to double check and make sure our T's are crossed and our I's are dotted, because we don't want to have a higher risk of bleeding afterwards. Why? Well, in this surgery, we're not doing a surgical procedure in which I'm purposefully stopping bleeding using special devices, suture ties, or anything like that. All we're using to stop bleeding is pressure. That's why you wear that compression garment. And in the end of the day, if the pressure doesn't do its justice because you don't have good clotting of your blood or you have a high blood pressure, that bleeding can lead to a lot of swelling or a collection of blood in your neck called a hematoma. We don't want that, and for that reason, we have to make sure that we've asked those questions and that you're not gonna have a risk factor for that. Now, the next is gonna be infection. The surgery has a low infection rate, a tiny incision. We just need to make sure that cannula that inserts and sucks the fat out is sterile. Other than that, I've never seen an infection even. The risk of scar, three minimal incisions, those are all small. What we really need to talk about is the scar on the inside. So this is scar that occurs after any liposuction procedure, just from the trauma of removing fat. And this is going to essentially be controlled and in a manner that we're trying to get a nice smooth sheet of scar that can help bring up the skin and tighten the neck. And that's gonna be where you know that you're going to a good surgeon who does a lot of liposuction, or a surgeon who's doing this with other procedures or here and there. When you can control and maintain a stable plane and control that scar, you can really do it. But having knowledge on how to massage afterwards, check out this video, and how as a surgeon to control that and as a patient to manage it are really, really important. Now let's talk about the next risks. So the first is gonna be not liposuctioning enough. I see this far too often. Patients don't get enough of a result because their surgeon did 3 or 4 passes of a cannula. They really don't know their boundaries, because the only way you know your boundaries is by getting really close to them. And sometimes surgeons really don't have that much experience.
That's the real tea.
Sometimes more liposuction needs to be done, or if you have enough fat, a assisting device called power-assisted lipo needs to be used to be able to get more fat out. On the other end of that spectrum, we have taking out too much fat. Now, in older patients, this can be a really devastating result called a cobra neck deformity. You can see what that looks like here. It's really rare in younger patients to take out too much. Sometimes we actually do it on purpose. We use an aggressive liposuction technique to get the skin and the muscle to stick together, to get the muscle to stick up. And that helps bring the skin in and gets you that Sagar snatched appearance. For a lot of my patients, I warn them about it because we're gonna do it on purpose in order to get these amazing results that you can see over here. Now, the last thing to talk about really is uneven lipo. This is really difficult to get perfect, and once again, this is where surgical experience really matters. Setting goals and expectations of knowing where there's going to be deep fat, where there's fat on the outside, and really having a feel for one's neck anatomy after it's been injected and inflated is really how and why you're choosing the surgeon you're choosing. If you have any questions, feel free to leave a like or comment below. I wish you luck in your liposuction journey. Make sure you check out all these videos listed here, and please subscribe to our channel.